All right, guys, we're gonna get there. He is. Wow, first shot this morning, huh?
We're getting good at this.
I know. All right, all right.
It's
So
almost like we do it every week.
I know. Um, so we'll let a few people log on here. So, guys, today we're going to talking about sort of what impacts movement. There's several things that can absolutely change and impact movement, but there's things that are more common and that aren't so common. So, I at from my experience, the sort of top three things that impact or affect movement are: one, just sort of your everyday habits and lifestyle. If you sit all day and you don't do a whole heck of a lot, you're not going to move too well. There are exceptions to the rules, and there are absolutely those outliers. But at the same time, if you're sitting all day or you are in a specific posture for an extended period of time, for most people, we talk about sitting and having that sedentary lifestyle. That's something that I think absolutely impacts movement. I would say that the second thing that I've seen is um, people that have old injuries and they never properly rehabilitate them. They skip PT, they don't do the things that they should be doing, and they have those compensations that initially happen post injuries, and they never rehabilitate those. And what happens is those compensations turn into patterns that get cemented, and that's when you see that person that had an old shoulder injury 10 years ago and they still can't move their arm over their head, or they have an old ankle or hip injury and they still walk with a limp because they've never actually spent the time to regain function or actually rehabilitate people. And I think one of the biggest issues with that as well is, I think when people try to get to the point where their function is back, they forget about the individual and they only think about the part, right? Oh, they've got a hip, so we got to focus on the hip, or they've got a shoulder and they only focus on the shoulder. So I think one of the biggest issues with that is just um, the individuals not doing what they need to really get back to where they were before the injury, because a lot of people don't even know what returning to function is. And I think that's something that we can absolutely talk about that a little bit more. But I would say those are actually probably my top two. Eric, what do you tend to see when it comes to things that impact movement besides the two that I just mentioned?
Well, to take kind of a step back, and I posted up on our stories the checklist that we have as part of our presentation in our live course of things that we need to consider. And where we're coming at this from is, um, look, you and I met through teaching a course about movement, right? And how to screen movement and how to address things. And people show up expecting that we're going to give you this library of magical corrective exercise, right? Always we have this approach to, if someone is not moving well, it's, I got to stretch this and strengthen that, right? This is weak, this is tight, and I wish it was that simple, but it's not. And so there's a lot of other factors, and that's kind of what the impetus for this week's topic was, is to get people to consider all these multitude of factors. So there's the more nuts and bolts that are more commonly related to movement that we were taught in school, of joint mobility, soft tissue elasticity, all these sort of different things. And we'll kind of run through the list as we go. But I also see it come to life when especially when I have a new person come in. So like yesterday, I had a kid come in. He's one of the top underclassmen prospects for football as a wide receiver. This kid is put together. I tell you what, I didn't look like this as a high school sophomore. But he comes walking in the door, and I said, okay, what's the primary thing that you're looking for? And he says, I need to get better hip mobility. Now, whether he figured that out on his own, whether coaches or scouts have told him you need to get more mobile in his hip, we put him through and to filter him to see if that's actually the case. We put him through a movement screen and a bunch of testing, and what we found is the last thing he needed was more hip mobility. Like, he scored well on all of his movement screens on everything mobility biased, right? What he really lacked was anything that involved any type of motor control or stability or awareness of positioning of his pelvis and so forth. And this is something I'm seeing more and more happen, is that if he goes into the traditional setting of my hips feel stiff, well, what are they going to do? They're going to give him hip flexor stretches. They're going to give him mini band walks, and they're going to think that's going to be the answer to it. And he'll feel good temporarily, and then he'll come back and be just as stiff the next day. So one of the things that I'm seeing more and more in doing this is the lack of attention being paid to motor control, right? And if you look at some of the work of Peter Attia, when he talks about like his big tenets of health, you know, he obviously he's very big on aerobic fitness and zone 2 training and so forth, but he doesn't talk about mobility, he talks about motor control and being able to control, because if you don't control that range, you're never going to keep it anyway. And then the second thing, and it's the top thing, one of the things on our list that we go through is hypermobility, and appreciating that person who is hypermobile. That how do I address that person? Because most people don't have an answer for them, right? It's easy to say, here, do these stretches, or we see these, and it's stuff like mobility WOD, stuff like Kelly Starrett is doing. That's, you know, FRC. That is awesome and incredible stuff, and there is much needed mobility work. But that's not necessarily always the answer for the person who's hypermobile, or that person who has stiffness or poor movement for a reason. And that reason is not necessarily soft tissue elasticity. It's not necessarily joint mobility. If anything, they have too much joint mobility.
Yeah, I mean, genetics absolutely play a role in, you know, running the Beighton scale on your individuals, especially if you run them, you know, we are guys that definitely start with the movement screen, but then we break stuff down, right? We always dig deeper depending on what that athlete needs. And and I'm seeing it more and more too. I think with the majority of the assessments these days, and we talk about this in the course, is they're very mobility biased, right? I mean, like you said, I mean, before Kelly Starrett changed the name of what's the name? It's like the Ready State. It was mobility WOD, right? So everything was mobility this, mobility that. And I think the cool thing about sort of seeing that shift in the industry is, yeah, everybody's starting to understand the importance of moving better, but they're lacking the ability to control things. And that's exactly what you're talking about. And it's a scenario where the average coach just thinks, well, they need more hip mobility, right? Well, yeah, well, maybe, but this is why you have to run assessments, because saying that you have hip mobility that you may have, like you said, you have great hip mobility, but you just can't control it. So teaching someone how to control it, or even educating them on the process. I mean, they have their minds blown when I'm like, you do not need to stretch. And they're like, I don't need to stretch. I'm like, no, you don't need to stretch. Do I still need to warm up? Yes, you need to warm up, but you're going to warm up very, very differently than you thought you would, right? And we can talk about the difference between motor control and stiffness and et cetera. But I think if there's one thing to take home from what you just said, Eric, is that the importance of a quality assessment, so you can distinguish what that individual needs. Because again, if you run through a Beighton scale and you're a 5 or higher on the Beighton scale, there's a pretty good chance that in general, you don't need a whole heck of a lot of stretching. There could be a certain part of your hip or a certain joint articulation within the hip that you need a little bit more of, but just saying someone needs more hip mobility is pretty biased. That's like telling someone to eat healthy. Like there's no specificity, there's no context. So absolutely, control is a huge thing. And I'm amazed at how many people don't even look into that component of movement. They don't even think about motor control and stability.
Or appreciate the concept of guarding, right? And how the nervous system is the ultimate governor of movement. And like the way I explain it to people is if you're getting surgery and you're going under general anesthesia, they will actually strap your arm to the table, because if your arm falls off the table, you can actually dislocate your shoulder, because now that resting tension is gone, because it's shut. Your nervous system is essentially shut off by the general anesthesia. And so that's where we start to appreciate the impact of the nervous system. And how guarding shows up is a lot of different ways on our checklist. So guarding can show up because of your sympathetically overdriven, right? And then we can talk about how breathing impacts movement. Guarding can happen because you have a lack of motor control. Guarding can happen because one of the most common things, my brother does data analysis for physical therapy. What's the biggest reason people fail physical therapy? Fear and avoidance of movement. If they're scared to squat, or they've been told I can't get down and up off the floor, fear and avoidance of movement. Your guarding could be because of previous injury, right? Even though that tissue is healed, your nervous system doesn't know it yet, and you still, like you said, limp when you don't need to limp. There's guarding because of protective mechanisms of any of these things that you have. And none of these are stretch this, strengthen that. And we can go down the whole list of things that we have, of just the concept of why you're guarding yourself and not allowing it to go. Now, how many times have we gotten someone into a position, we say, okay, take a deep breath and then breathe out and let it go. And they figure, oh, I can get here, but I couldn't get there before, right? Your visual acuity will have an effect. Like if you go and try to turn and then let your eyes go first, it's going to allow you to move further. So all these things are things that are not, again, and that's really what the thrust of today is all the stuff that are movement, all the things that's movement related that you're either not considering or you're not fixing with a quote unquote corrective exercise of stretch this, strengthen that, right? Now, the biggest impactor of movement, the biggest driver of anything in your nervous system is pain, right? And so we get the question all the time, well, do you do a movement screen on somebody in pain? No, because it's going to alter their feedback, both outgoing and incoming. And so that's why you have things like the SFMA or you have clinical assessments. That's for pain. You're never going to get true movement when you're looking at somebody who's in pain. And so there's no point in trying to assess movement at that point from a performance side, from a fitness side. You have to look at it clinically at that point and splice up your parts. That's where you're going to look a little more regionally and definitely more locally.
Yeah, I mean, pain, absolutely. It's one of those things that it 100% does impact things. And I've been working with in the last 5 or 6 years a lot of people with low back pain, and I always tell them, because they're people are like, I heard you could help. I'm like, yeah, but I'm like, if you're currently in pain, there's nothing I can do, because they're going to come in and you can even tell it. And or if you've even been there, you have low back pain, you gingerly get to the floor. You're very specific about the way that you stand up. Everything is a slow and a very methodical based movement, because if you move a certain way, you're going to get that zing, right? So everything tends to slow down, and it's really, really hard to make those changes when someone is in that sort of acute scenario, right? It's the same reason why if someone rolls an ankle, right? You don't immediately go and start doing rehab drills, right? It's a bad idea. The first thing you got to do is let the body respond to whatever's going on, and then eventually you can start to have some sort of intervention that is going to be more specific to the individual. And generally when it's injury related, you're going to defer out and use a medical professional in that case. But it's really hard to make those changes when again, people aren't paying, and people are scared to move, and that's that movement avoidance thing that you just talked about. I mean, I've been there, man, and it's when you're feeling like crap, everything that you do is like walking on eggshells, and it's just tough.
It's funny you say that. Since I work with a lot of high school teams, I'll get coaches that, a kid rolls his ankle in the game, he's run down and he rolls his ankle. He goes, "Hey, can you help out?" He rolls his ankle. Like, not now, too late. I said, you needed me 3 months ago. That's when you're not now, right? Now is where you need the athletic trainer. Now there's two things that we use. One is in the FMS course, and there's one that you teach in our PPD live course, taking into consideration anatomical factors. So first I'll refer to the one in the FMS course. We show a great slide that shows the anatomical differences in 3 different hips. And so you have the femur and the head of the femur and how it sits in the socket. And there's some people where it sits where the head of the femur is almost higher than the socket. Then there's ones that are more parallel, and then there's ones that are more in a downward angle. And I always say, okay, I ask the group, okay, which hip do you have? And most people kind of, I don't know. And I say, if you don't know, it's a good thing, because usually the only reason that you know is some bad shit happened along the way, and you need to find that out, right? And so with that, if you don't know, obviously how someone squats here versus here versus here is going to change some things. And then you add in if there's anteversion, retroversion, all that sort of stuff. So telling everybody they got to squat with their feet straight is going to change depending on how that articulation is in the hip. So we can't have these, hard and fast rules of this is what everybody should look like in a squat or a lunge or so forth. So appreciating those anatomical differences, and that's a great way that we kind of enlighten people to that. And so we'll say, well, in the FMS, why do you have them do the deep squat with their feet straight? Well, that's just for standardization. That's not how we would coach them in the gym, how to do the squat. The other thing, and this I'll let you speak on, is you do a really good talk in the live course talking about the effect of lever lengths, right? And kind of expanding on some work that Tom Purvis did. He did a great talk on the squat. So you want to talk a little bit about just like how people just fold differently, right? Because of the length, the relationships of the length of the different limbs.
Yeah, and we won't go too in depth about it because Tom Purvis, and if you actually go on YouTube and look at just search for Tom Purvis squat and foldability, you're going to get a really, really good demonstration of how changing the levers impact movement. So, so this is something that I think a lot of people they don't have the ability to. First of all, this has never even crossed their mind about looking at body proportions. But if you've been working with an athletic population for a while, you've run into this, and you probably knew that person can't squat upright, but you didn't know why. And you try to do all the, the tricks in the book, right? Chest up, do all the hip and ankle mobility drills in the world. But when you start to look at the study of the limb lengths with this anthropometry and the relationship of the limb lengths within those individuals, you can really start to understand that I don't care how many mobility drills that you do. And like you just said, depending on the anatomical shape of the femoral head and the acetabulum, and then you pair that with the limb lengths of each individual, guess what? People are going to move differently. So let's say I'm going to give you a very, very sort of common scenario. You get someone that has a really, really long femur in comparison to their tibia. That individual is not going to have an upright squat posture. It's going to be damn near impossible. Now, if you wedge their heels about 6 inches and you did a bunch of other things, maybe you could clean that up a little bit. But all you're probably going to do with that individual is if you keep on saying chest up, chest up, chest up, all they're going to be doing is cranking themselves into extension, and you're probably going to cause other issues. So you have to understand how that individual's anthropometry is going to impact movement and your exercise selection. So you take that individual with the shorter tibia and the longer femur, and you have them front squat with an anterior load. It's never going to go well unless you can find a way for them to go so wide and so externally rotated and abducted with their hips. And then you basically put them in a movement pattern that is not even remotely athletic, but you're trying to do everything you can to complete the front squat. Well, guess what? It's not going to work. So those are the times where you have to sit back and say, well, you know what? This person, short tibia, long femur, front squatting is just not going to be an advantageous exercise for them. It's just not. Same thing with the double kettlebell front squat, right? You try to give that person a double kettlebell front squat and they're already folded in their posture. Their elbows are going to shoot up high because there's no way that they're going to be able to keep their elbows connected to their rib cage as they descend because they're just so folded over. You can't keep that vertical posture. Whereas if you get someone that has relatively same height tibia, relatively same height femur, and let's say even their torso is a little bit shorter in comparison, guess what? That person is going to have fantastic proportions to squat in general. And what we're sort of talking about, that we need to, two different things that we need to sort of talk about is when we're talking about, we'll use the squat as an example, squatting like a baby. And everyone talks about that. And guys, I'm going to tell you right now, even though it's a little bit of a tangent, babies squat a certain way because, first of all, their head is basically the center of mass, and they need to be able to balance their head over the rest of their body. So that's number one. Literally, they have to balance the orange on the toothpick. That's number one. And then number two, they don't have all of those bony adaptations yet. Literally, their hips are still cartilage. So they can drop down into that deep squat and hang out and play and do a whole bunch of things because guess what? The joints haven't formed yet. So that's another reason why people can squat like that when they're younger, right? So those are all of those things we have to consider because like you said, it's not just about stretch and strengthening. And I wish it was because, man, that would be so damn easy if we could just stretch some hip flexors, do some ab work and strengthen their glutes and everything would just magically get better. But it doesn't work like that. And these are all of the various considerations that you need to consider because if you've ever worked with someone, and again, while you squatting as a movement, God, it's not going to work, man. It just will not work no matter how hard you try. And if you try to force that, it's probably going to make things worse.
So two things that you said I'm going to pick up on to finish up our kind of our first list of the more musculoskeletal common things that are related is one is you talked about, okay, on the one end, you have these babies here, their joints aren't yet developed, but let's fast forward now 40, 50, 60 years and how the move is smoother. Now we have someone who says, I'm arthritic. Well, arthritis, a great way I heard it described it by a clinician is arthritis is a nutrition issue. That doesn't mean you got to drink milk and take glucosamine. It means how do your joints get your nutrition? It's through a process called imbibition. And there's a cushiony ends of cartilage on each end. And as you compress, and that's why weight bearing exercise is so important for the health of your joints, as they move, they squish, and then it will release it'll lunge all those nutrients. Well, if you don't move through full ranges of motion, your body will eventually adapt to the shortened range of motion. Then when you're asking them to go to that full range of motion, they're going to say, oh, they're going to feel that grinding in their joints, or they're going to get the clicking or any of those types of things that we have. And so that's going to affect movement depending on how those joints have aged in terms of allowing them to go to full range of motion. And as we age, we use less and less range, right? So think about it on the other end of things. The other thing you talked about is posture. Now, posture, most people, right? I used to have one back in the day with my assessments. You stand in front of a grid, right? And you see how does everything line up. Well, that's just one static snapshot of this, like, police lineup thing that you're looking at. But posture is really, if you took a snapshot of anything dynamic and just took that frozen moment of time, well, that's a posture as well. And so if we look at things like the shoulder, right? For the shoulder to move because of the rhythm that should happen between the scapula and the humerus and the thorax, if robotic position, and then try to raise your arm up overhead, you're going to get this really crappy, pinchy feeling here about, 3/4 of the way up. And you could say that's an impingement. Well, yeah, but doesn't mean you need to go get surgery and get stuff cleaned out and scraped out and removed. It means you need to be able to extend your spine, because you go and extend your spine and get tall, and wow, I'm up there nice and easy. So that's not a shoulder problem. That's a communication and timing problem, right? And so that posture position, same thing, go back to your squat. If the position of the pelvis, if someone immediately, how many times you see somebody just immediately dump their pelvis into an anterior tilt and they arch their back? Well, they're going to jam up way sooner in their squat than someone who can hold their pelvis in a neutral. Or if they're really talented in squatting, a good power lifter will teach you, you're going to pull yourself into the squat, and that's going to help keep you in that neutral, right? So the position and posture of all your joints is going to affect your movement, and it has nothing to do with it. It's a matter of, do you even have the awareness of those positions? Ask somebody to try to get their pelvis into neutral, and 9 times out of 10, people have no idea what that even looks or feels like. Now let's shift gears, right? That's all stuff that's kind of somewhat makes sense to the average trainer, clinician, or even average person. Say, okay, I can kind of see those connections. But then there's the stuff that people don't think about. And number one on that list is breathing. And it freaks people out, right? We do an FMS course. We say, okay, I want you to go do 20 crocodile breaths or 20 90 breaths, and they come back and their leg raise improves, and they pick up 30-40 degrees of range of motion and an active straight leg raise laying on their back, and they're freaked out. They're like, I don't understand, like, we didn't stretch our hamstrings, we didn't do bridge, like, how did that happen? Well, there's structural things that might have changed, because you might have, that breathing, obviously is happening from your diaphragm. That's going to change the position of your thorax, and that's the positioning of your pelvis and how that interrelates, and that's going to have more of a somewhat direct thing. But then you have the effect that going into that deeper type of breathing is going to have on your autonomic nervous system, and now you down regulate, and that person who was in that guarded position now starts to let go, and they're not as bracing, and those sorts of things. So creating that awareness just through breathing. And then we go on the other side of it, right? Some of the stuff that you guys teach at Strong First, of teaching how to create extrinsic bracing and breathing, that creates tension, which is going to allow someone to get into a pistol, or allow someone to get a single arm push up or something like that. And that's going to affect movement quality as well.
Absolutely. Two things I want to sort of dial in on what you just said is, breathing. Breathing is the only autonomic function that you can control. So it's one of those things. When do you think about breathing? When someone asks you to think about breathing. Because if you had to consciously think about breathing all day, you wouldn't be able to do anything else but think about breathing. So it's this autonomic function. Here's the cool thing, man. And again, I can't stand the term biohacking, because I think it's a dog shit. But at the same time, if there is one way that we can sort of biohack our system, it's by learning how to breathe and learning how to down regulate our nervous system. Because breathing is pretty important. And guys, listen, talking about the importance of breathing is nothing new here. This has been something that has been around for, hundreds of years, like even before modern sports science, strength and conditioning, and physical therapy have been around. This is something that has been around for a very, very long time. But I think we have to understand the importance of it, but just not overdo it, because we need to focus on breathing when it's necessary. But if someone breathes well and they already understand that, cool, we've checked that off, and then they can move on to the next thing. So that's one thing I want to say about breathing. It is super impactful, but at the same time, it is just one piece of the puzzle. And then the other thing is, we talk about tension, right? If you've ever had a massage, whether it's a relaxing massage, with the champagne and the chocolates, that's one of Eric's favorites, or a little bit more of an ART sort of massage where they're really getting in there, they're never going to say to you, hey, when I'm working on you, can you do me a favor? Can you be a little bit more tense and maybe hold your breath? They're never going to say that, right? What they're going to say is, all right, try to relax, try to breathe, try to exhale, right? Because why? Because we know that the body is going to have more of a positive response when you come to the table not tense and not overdoing it, right? Because if someone's getting in there and they're starting to be really, really aggressive with their soft tissue work, you're going to start to do things. And if you're not paying attention, that massage that was supposed to be therapeutic may not be as therapeutic as you want, because it was supposed to be this relaxing thing, and the whole time you're tensing up and your neck's flaring and you're holding your breath. Well, guess what? The whole point of getting tissue to relax is trying to create an environment where if you do decide to attack that soft tissue, it's going to be a scenario where you're planting on fertile soil, right? You're not trying to put those seeds on concrete. So you have to be able to create that environment to make sure that whatever modality, and when we're talking about breathing, if you're coming in and super tense, and maybe even if you're in pain, you got to learn to just relax, and breathing is one of the best ways to take someone in that sympathetic dominant state and sort of down regulate that and have a little bit more balance between the sympathetic and the parasympathetic nervous system.
Man, the next thing is sleep, and we don't factor enough for that. And one is, from a movement standpoint, you get people come and say, "Oh, I slept." I never got the manual on the right way to sleep, right? And then I explain, okay, well, what are you going to do? You're gonna have a coach that pokes you and says, "No, your arm's in the wrong position. Fix that." That's not controllable. And so we look at, obviously your sleep environment and how you're setting yourself up in terms of, the right mattress and pillows and all that stuff. That's a whole nother conversation that's more on the structural side. But how the sleep affects your nervous system is there's some really good data coming out that shows the risk of injury going way up when you have less than 6 hours of sleep. And why is that? Your reaction time goes down. Your nervous system function is going to go down. So movement quality is going to go down. Your ability to create rate of force production is going to go down. And if you've ever used any of this stuff with VBT or looking at any type of speed of movement, you're going to see that go down. So those are all things that are significant factors that are going to be affected by sleep quality. And then with that, I'll kind of jump on the next thing is something that's been, this week's Twitter feud is about the value of things like VBT, and talking about how, because it's become the new hottest thing, if I'm going to put a push band or one of these types of Tendo units on the bar, that we've swung so far in that direction of speed that we've now got people doing really crappy quality movement super fast, and that's just going to exponentially increase the injury risk. And so intent has a huge factor in terms of movement, in terms of how it's going to look in terms of things. So whether it's you're throwing a medicine ball, whether you're using a VBT type of device, whatever it is, intent is going to have a factor, but you can only put so much intent on top of crappy quality. And that's going to affect things as well. So looking at things in terms of intent. Now, a mental factor I posted about last night is, right, and how that affects things. And I mentioned Thomas Hanna has a book called Somatics, and he talks about red light posture and green light posture. Red light posture is this kind of sunken hiding away, leave me alone type of posture. And a green light posture is more this confident, chest up tall type of posture. And obviously that has nothing to do with tight or weak, right? That has everything to do with I'm having a really crappy day or I'm feeling really good today. And how you stack up everything back to what I said from positions and postures in terms of how we're going to load you. And considering that and not necessarily rushing to, I got to strengthen, stretch this or strengthen that, that's another consideration. I'm going to go through two more and then I'll pass it to you because there's a perfect handoff here. Is climate is going to have an effect, right? Ice cold yoga hasn't really taken off by me, and you're in Boston, so it may be a little different. But the ice cold yoga shops, but because obviously that's going to have an effect on things, right? In terms of temperature, right? The difference of anybody who's tried to play a sport in the cold, you feel like you're made of bricks. You just don't move as well. Temperature is going to have an impact on your quality of movement. And then something else that from the inside out, right? That's more outside in. Inside out is your gut health, right? If you have inflammation in your gut, well, they're tied into the same neurological loop as your abdominal wall of all those inner unit muscles. So you're going to lose a little control and stability after pounding down Taco Bell for lunch, right? So that's going to change your movement quality, right? And so because of that, you can have things that are going on that are going on at the level of the organs, right? And there's what they call viscerosomatoreflexes, where organs control muscle. You can't feel your heart, you feel your arm go into a seizure, right? So, if you haven't heard this before, tell everybody kind of how your low back pain spiked up, what that kind of related to from a movement standpoint, and what the actual cause really was.
Yeah. So, well, first of all, my first low back injury was in my early 20s, and it was just for two reasons. One, I was an idiot. I was just doing things that I shouldn't be doing. I was just overdoing it. Okay. Two, I'll be honest, I didn't even understand what moving well was. I just knew that I was this athletic young guy and I could pick up some heavy things and move some appreciable weight. And guess what? Eventually, it sort of bit me, right? And I did have a low back injury where I had a couple small herniations and blah blah blah. But over the last few years, I would just get random intermittent back pain. Just all of a sudden, my back would start bothering me, and I was like, "What's going on?" Like I didn't train. Usually in the past, I could be like, "Why does my back hurt?" And I could trace it back to something. You know, a long car ride followed by a hard workout. Well, guess what? That doesn't usually tend to go so well. But I was having this crazy intermittent back pain and I didn't understand why. And, at the same time, I was dealing with a lot of gut issues and, just stomach issues in general. And I don't want to get into too much detail, but that's when I went and got a colonoscopy and found out I had stage 3 colon cancer. And one of the main reasons why I had a bunch of chronic back pain was simply because there was a tumor in there that was messing with everything around there and had started to spread into my lymph nodes, etc. So now I'm not using this example to scare you, being like, if you have low back pain, it's a tumor. But what I am saying is that there are several reasons why pain can be present, and just simply discarding, oh, it's just my low back. I think that's foolish to think that it's just something that isn't much of a big deal. So there are several reasons why you could have random or chronic pain. And it could be an old disc injury. It could be tight muscles. It could be, something a little bit more significant, like my scenario where where I was diagnosed with cancer. But at the same time, there are so many things that can absolutely impact movement. If you don't ask the right questions and you aren't aware, and to be honest, if you don't have the knowledge and the skill set to even think about other things, you could be missing something. And I could tell you 3 or 4 times where I have had personal training clients that have come in and they didn't feel right. Something was off. And I said, you need to go see your doctor. And it was something that was more significant than, tight hips and, a weak core, right? So you have to be able to look and in Eric's earlier post this week, he talked about all these things that impact movement. And in our course, we dig so much deeper on all of these things because it's important. And now there are things that you can change and there are things that you cannot. But if you don't do the due diligence and ask the right questions and step back and really look at that checklist, you could be missing something that is a lot more important than just my old back.
Another thing from the inside out, right? And
Yeah.
especially comes into play if you work with females. You have scenarios where if they're going through the menstrual cycle, that's going to affect their movement quality and control. And then especially if you're working with women who are pregnant, obviously they're releasing hormones like relaxin, which is going to affect their joint integrity. And you have to be super careful in terms of how much mobility and flexibility work you give them, because you can actually create some incredible instability and joint damage. Hormones that need to get considered as well. Then you look at some more psychologically related things, right? You have one, we talked about emotions. Two, you have cognition. Like, do they understand what movement you're even supposed to be doing, right? They think they're doing something, but they're actually not, right? Whether they don't have the awareness, the proprioception, they don't have the mental imaging, those sorts of things. Do they even understand what it is you're trying to explain to them? And to jump off, are they mirroring or mimicking what their imagery is, what they think that movement should look like? Or maybe you just really suck at demonstrating exercise. And so now because of that, they're going to suck at reproducing that image that you just displayed to them. And, in one of the posts I had this week, I talk about, like, as a strength coach and I'm working with teams, I want to make sure that when I set up my lines, that the people who are more proficient at the drills, put them in the front of the line. Because if they're really crisp at their skips and they're really good with their footwork, everybody behind them is going to try to emulate what they did. But if you put that beginner in the front of the line who goes right arm, right left, right arm, right leg, same time, then there's nothing for that person who's the beginner, who doesn't have this mental picture, doesn't have this programming and engramming in their nervous system. They're going to just copy what they see in front of them because they're going to want to emulate that. So mimicking is something. And then last but not least, you have, the fact that movement is just a habit, right? And the best way I describe that, and I had a post that I have somewhere back talking about how it's a habit. Like, if right now I ask you to fold your arms, and I'll do this in the class, I'll say, all right, just fold your arms. And I'll go around the class and I'll say, okay, well, some people have their fingers wrapped around, some people tuck their hand under, some people have their left on top, some people have the right on top, some people hold it high, some people hold it low, and there's no one right way you fold your arms. But then if I tell people, go ahead and switch, it's insanely awkward for them to do. And so that's just because this is their natural patterning that they've gone to. And that's just a habit. Whether it's you lean onto one side, we have it with baseball players all the time. And Eric Cressy does a great job of talking about postural effects of that outfielder who leans on the left hip while they're waiting for minutes on end for a ball to come to them. All these things are habitual that aren't necessarily driven by something that's a conscious thought. It's a reflexive thing, and now that's developed a whole new pattern, which has changed joint angles. It's changed length tension relationships. It's changed all those things. That's going to ultimately affect their movement, their force production, their control, their mobility, all those factors. And then one last thing from the inside out off of our checklist is hydration. Right. And if you're a good manual therapist, they can tell you when that client or patient is dehydrated because of the tissue quality. And if that tissue quality is not good, obviously it's not going to move as well. It's going to affect, your blood is primarily made out of water. Your circulation is going to be affected. And so that's going to impact some things as well. So this is a laundry list that goes way beyond tight hip flexors and weak glutes, right? But all of these are going to ultimately impact your movement. Now, sometimes we get the low hip flexor and you do a bridge and they're better. But if you come back the next day and they're just as bad as they were the day before, well, that wasn't the issue, right? So this is kind of the thrust of why we came up with this course, is to look at these topics, like whether it's your initial intake with a client, whether it's your testing systems, whether it's your exercise selection, it's how you put together your programming, is that we want to make you stop and think and say, oh, I never considered thought of that, you know? And so that's kind of why we kind of went down this road. And each week, you know, each topic is to kind of make you scratch and think and say, you know, I need to start looking at that. I never really considered looking at someone's bite and score. I need to look up what that is and figure out, you know, holy crap, I've been stretching hypermobile people all this time, right? Anything else you want to add there, Mr. Perry?
No, I think you really covered it, but just remember there are things that you can control and things that you cannot. And a good coach will go through these checklists to make sure that they are recognizing the things that they cannot control and then doing what they can with their skill set and within their scope of practice to make sure that they are trying to manage the things that they can. And it sounds kind of like a life lesson as well. Control what you can and don't worry about what you cannot. But at the same time, it's really, really true because when you're more aware of how that client is functioning as we step back, because everybody wants to talk about the best assessment, right? Well, the best assessment is to ask a ton of questions before you even do the assessment to really understand what sort of state that they're currently in. So, you know, that's the thing that's the message we're trying to get across, guys. We understand that, you know, this stuff is not as sexy as giving you 25 drills for the rotator cuff, but at the same time, this stuff needs to be talked about, and these are the questions that need to be asked because there is no shortage of cool exercises on social media, right? You can find a bazillion different ways to bridge, to press, to pull up, to blah, blah, blah. But again, you have to step back and ask the right questions before you can give the correct answers. So think about those things that we talked about. Think about, you know, hydration, sleep, habits, sort of anatomical variations. If you have had imaging in the past, you're going to understand, you know, maybe there's a reason why I don't have X amount of internal hip rotation. But if you keep on trying to bang away at that, it's not going to go so well. So these are the questions we need to ask ourselves. And these are the things you need to dig a little bit deeper on. And learning what you can and cannot control is a big part of a successful training program and a successful outcome rather with your clients and your patients.
Yeah, and the other thing, the last piece I want to add is, you know, one of the other things we wanted to be within our course is to be a resource of, you know, create this course. We're standing on the shoulders of everybody that we've learned from in the last, you know, 20 plus years we've been doing it each. And so like when we look at things like movement, we're trying to attach all this to exercise, right? Because that's what we're associating with movement, but movement's a lot more than that. Like look into the work of Katie Bowman and understand that movement is about your environment that you're living in, whether it's your, you know, your clothing, whether it's your surroundings of your home and your movement throughout nature. Vision has an impact on that. How you get your food, how you eat your food, that's going to all have an impact on it. And so she really sheds the light on it. There's way more to movement than I'm counting my steps and how many calories I burned or how much weight did I lift or how fast did I move. That movement and exercise are sometimes the same thing, but it's not always the same thing. And that there's a much bigger world in that. And then we also look at within that, okay, well, what about the movement of I'm trying to an actual skill, right? Because that's movement as well. And I wrote an article called "It's Just Movement." I should probably repost that, where I talk about like what we do and what your MMA instructor does and what a ballroom dance instructor does and what a pitching coach does. We all just teach movement. It's just a different expectation. It's at different amplitudes. It's at different speeds, different positions, different implements. And different levels of repetition. And at the end of the day, we're just teaching movement, right? And so we have to look to kind of your point before is to say, okay, what are the things I control and can't control? So if, you know, we look at like what TPI or On Base does to say, okay, well, you have, you have to throw the ball this way or swing your club this way because you don't have internal rotation in your lead hip. So you're going to do one of two things. You're going to either glide and shift your hips and sway, or you're going to just bang into that hip and beat it up. So you got to do one or two things, either get more internal rotation in your hip. And if that's not possible, you're going to have to change your swing. You're going to have to change your delivery because you have to work around that issue that you can't change now. So you're going to have to change the skill around that limitation if you can't take away that limitation. And so that's really the art of teaching movement from from the movement skill bias of trying to develop a sport or learning to dance or any of those type of things. So a couple exciting things we got coming up. If you're not aware, we have our online now available. But we also created something else this week. You know, Mike and I were talking about different ways we want to get this out there, and I joke with Mike, you know, because you're joking, you know, joking about the you know, the things we compete against on social media and Instagram. You know, the top 10 secrets, you know, the top secrets of the pros and the top secrets of the best fitness pros in the world. And I said, you know what? I would suck at that because I'm really bad at keeping secrets, and I'm like really excited to share like all the stuff we put together. So I said, let's do the opposite, free. So I went through and with Mike, and we took like snippets of some of the best stuff from our online course and trimmed the 2-hour course down into about 15 to 20 minutes. And it's up on our site for free. Go to principlesofprogramdesign.com and you can get a free preview course of the stuff we're talking about in the course of our online course. And so go ahead and check that out and see kind of the stuff we're working on. So we're excited about that. We're also 1 week away in counting from our first live course. It's going to be a full weekend in Cherry Hill, New Jersey, just outside of Philadelphia, so you can get some cheesesteaks and learn about training. We are going to have a FMS Level 1 course on Saturday that I'm teaching, and then on Sunday, Mike's coming down. We're going to teach our first 8-hour course, which is hugely interactive. We just went through, again, some new stuff we're adding in that we're really excited about to get people engaged about how we go about writing training programs, and that's going to be next a week from Sunday. So still have spots available with that, or if you want to check out our free online course, please do that. And if you have any ideas or questions for these Instagram lives, we're going to be doing something very cool with these in the next month or so before summertime hits, so stay tuned for that. And also check out our posts throughout the week for each topic that we do leading up to it. Next week, I believe, I have to check again, but I believe next week we were talking about and what to consider when we have people who have knee issues or concerns and how that may impact their training.
Absolutely. So, you know, guys, if you found this helpful, do us a favor, tag your friends, share it with your friends and colleagues. And again, if this is something that you're interested in, you want to learn more, you can shoot us a DM and we can definitely fill you in on some of the other things that we offer. So we appreciate you guys tuning in, and this is going to be live. Once we're going to post this on my page, and then we're going to repost it on the Principles of Program Design Instagram page as well. But hopefully you guys check out the website, and we'll go from there. So enjoy the weekend, and we'll see you guys soon.